So speaking of how far we've come, it's nice to hear that since you started, when you were in training and to now and that you're seeing a lot of improvements. Are there any other is there any other emerging research in the neurosurgery field that patients should know about? I know that you also run a lab and you're a researcher. And so anything you can highlight that would be of interest to patients living with brain metastasis?
Yeah, I mean, I won't bore people with some of the surgical technique stuff, but we're always trying to make our procedures less invasive. So there's ways to do things through smaller and smaller openings that are kind of so the surgeries are more tolerated. But we have a lot of technologies that allow us to visualize things in 3 dimensions during the surgery. And in fact, there's a technology now where instead of having to look through a microscope, and crane my neck, everything's out on large screen TVs in 3D. We wear 3D glasses in the surgery. And then we have technologies that allow us to manipulate things like white matter tracks, which are the kind of wiring in the brain that connect important structures. So we can actually plot trajectories that really thread a needle through areas that are pretty treacherous in the brain, but we can now get there safely based on a lot of these techniques, particularly combining them with things like mapping that allow us real time in surgery to detect that a specific area of a person's brain is functional and that we shouldn't touch it or disturb it. So I won't go through all that. It gets a little technical and boring.
That's still very interesting. I didn't realize that. So thank you.
I can remember giving a talk to one of the clinical heads of our cancer center. Well, he was in the audience. And I gave a talk recently highlighting all these new neurosurgical technologies and showing videos of kind of all these cool things. And this is someone that's been around for a long time and certainly refers patients on to us for surgery. But even afterwards, he just said, wow, I just can't believe the stuff that you guys can do these days. And he's been around the block, of course. So I think there are a lot of new, exciting things that are coming out. And I think that's on the surgical side. But more importantly, frankly, as far as kind of impacting patients and their survival and their quality of life are the types of therapies that are coming out. And I think you and I were talking earlier about the notion that previously patients who developed a brain metastasis, let's say while they were on a clinical trial, kind of got booted off the trial. And for a variety of reasons, none of which really matter, but that shouldn't be the case anymore. And in fact, one of the things we've done in building a center at Duke is we've focused, and that was always our motto, was from forgotten to focus, right? So we take patients who were getting booted off these studies and said, no, we're going to focus on these patients because there's a lot to be done here to help them. And so now instead we have clinical trials that are the criterion to be on the trial is that you have a brain metastasis. And we have over a dozen of those open at our institution. And I think you'll start to see that be a trend. And a lot of those are treatments that are, meant to get into the brain or are meant to treat cancer regardless of histology, et cetera, et cetera. And so I think there's just a lot out there now that is available to folks as long as they're willing to, like you said, get a second opinion or kind of do their homework or travel or what have you.
And also to participate in a trial. I think if we can get more patients participating, that's going to help as well. But the truth is, part of the work that I do is we need more trials. There's so many that are excluding the patients. And even when you have I've seen a lot of trials where they say, oh, sure, brain mets patients can participate. We really want trials that are specific to brain metastasis and, frankly, leptomeningeal disease. So I'm really happy to hear that Duke has a dozen or so. We're going to highlight those on the website as well. And I think that was all I had today. Did you have anything else that you wanted to add?
Yeah, sure. I'll certainly mention a few things that I think are exciting. We have, as we've built our center, really tried to focus on all areas. And so we do focus on leptomeningeal disease. We've published on it. We have a researcher at Duke who has uncovered some of the mechanisms of leptomeningeal spread. And we actually have submitted recent research proposals on it too, to try to understand that late stage of metastasis. Again, to say, these are folks that people perhaps are giving up on. We don't want to do that. We want to discover the next path forward. And so a lot of those things are occurring at various institutions, not just Duke. But the key point here is that these patients with brain metastasis are now becoming a focus of medicine. And it's important to recognize that part of that's because as people survive longer with cancers, as our therapies get better, larger proportions of people will survive long enough to develop these kind of late stage portions of cancer where the cancer can travel to the brain or the spine. And so now we really need to focus our effort on tackling that problem. And we do a lot of research ourselves on that. I myself am engaged in some really exciting research projects where we have some novel therapies that are perhaps just a couple of years away from getting into the clinic. I work with a Nobel laureate there, and we have discovered a novel target. We have drugs that are coming out for that. And I think it's an exciting time to be in medicine. And it's an exciting time in so much as it can be exciting to be a patient with this problem where previously you may not have felt there were options, but now there really are. And there's a group of people out there who are looking to make your symptoms better, your lives better, and your treatments better. And I think I'd like to include myself in that group, but I know there's a variety of other folks out there doing the same thing.
Well, that is wonderful. That is music to my ears and probably many other patients to know that there are therapies coming down the pike. I think we're all very excited. And I'm very grateful for you coming here today and chatting with us. And I'm grateful for the work that you do. So thank you so much.
My pleasure.